Hi, everyone. Welcome. As you're joining us, can you please put your degree program in the chat so we just know who's with us today? So whether you're HPAM, Community Health, EpiBio, Environmental, you can just put that in the chat. EpiBio, great. Health policy, awesome. Okay, wonderful. So we're going to just go ahead and get started. Of course, we know other folks will be joining us shortly, but my name is Maya Lloyd, and I am the Student Career Program Manager for the Office of Career Services. And today we are going to hear from the Office of Emergency Preparedness and Response, or OEPR, at the New York City Department of Health and Mental Hygiene. And we're going to hear about their Pipeline to Preparedness Fellowship Program, which is a 10-month paid opportunity for students where fellows gain a broad and practical understanding of the field of public health emergency preparedness and response and the career opportunities available across OEPR and the Department of Health. We will also hear from a fellow CUNY SPH alum on their own experience as a fellow with the program, so we're very excited about that. Before we do get started, it is best practice to have your camera on, so if you are in a space to do so, please turn your cameras on. We want to show our guests that we are interested and engaged and receptive to the information they're sharing with us today. So again, if you can, please turn your camera on so we can see your wonderful faces. If you have any questions, please feel free to put those in the chat as well. There will be a post-event email sent out with the event recording and a link to the fellowship application. And with that, I will hand it over to our presenters.
Thanks, Maya. Hello, everyone. Thanks for coming today. I'm really excited to share some of this information with you. My name is Matthew Silverstein. I'm the Director of Strategy and Program Development in the Office of Emergency Preparedness and Response at the city's health department. It's quite a mouthful. And with me today is Saba Hashmi, who will introduce herself and her sort of component of the presentation. Today, I'm going to, like Maya said, share a little bit of information about the health department in general and what our office does. I'll talk a little bit about the fellowship opportunity, which Maya just talked about, and some of the other sort of job postings if you're a student that is graduating soon. And Saba will, again, like Maya mentioned, talk about her own experience in our fellowship program. So just to start with the basics, a very basic overview of the city's health department. We are the oldest and the largest local health department in the country. We were created in 1866 to combat, it was yellow fever and also cholera outbreaks in New York City. On top of being the largest and oldest in the country, we're also one of the largest in the world. We have a budget of, it's actually a little bit closer to 1.9 billion these days and around 6,000 employees. And, you know, we were founded to sort of address these infectious disease outbreaks that today we would consider public health emergencies. And so we have a very long history of responding to public health emergencies, which include infectious disease outbreaks, but also natural disasters, sort of violent attacks, all kinds of different emergencies. We're really talking about any kind of emergency when we say emergency preparedness. The health department in general, what we do, there are lots of different things that we do. It would take me hours and hours just to explain to you everything that the health department itself does. We have many functions. So we do on sort of a day-to-day basis, we're doing outbreak investigations for different diseases, you know, measles and all these sorts of things that you've heard of. We do all the restaurant inspections. So all the letter grades that you see in restaurant windows, that's us. We do you know, pest control and rat prevention. We provide patient care at our many sexual health clinics around the city, including abortion access. Most recently, when Roe v. Wade was overturned, New York City decided it would provide abortion services itself to anybody who needed them. But we do many, many other things. We issue birth certificates. We track every birth and death in the city. People register their dogs with us. We're the ones who oversee all of the animal shelters. We do school health. All the school health nurses technically work for the health department. There are hundreds to probably thousands of functions that the city health department does. And one of those is emergency preparedness and response specifically for public health emergencies. New York City is a really high risk place. You may learn in your public health studies that sort of rare events become more likely, the more opportunities they have to occur, right? The sort of more interactions are happening, rare outcomes are more likely to occur. And the same thing sort of applies to emergencies. When we have 9 million people living in the city, many of them over the age of 65, we have sort of this silver tsunami, right? A growing aging population. We have people who speak hundreds of different languages, all sort of like pressed together. And on top of that, there are millions of people moving in and out of the city every day, 3.5 million people riding the subway, 2 million commuters. We have 2 international airports, 100 million people visit our city every single year. And so as a result, it is more likely for these types of public health emergencies to occur in New York City than someplace less populous or less hustling and bustling. To show you sort of, this is kind of coming back to the functions of the health department. Before, this is the org chart for the entire department. I'm not going to spend a lot of time here, but you have your commissioner at the top. Our commissioner of health's name is Dr. Michelle Morse. Each of these boxes represent what we call a division that oversees sort of large programmatic areas of work. So mental hygiene or disease control or environmental health or family and child health. And then each of these lines within there are what we call bureaus. They oversee sort of the specific programmatic areas. So within the division of mental hygiene that oversees all of the mental health work, we have the Bureau of Alcohol, Drug Use Prevention, Care, and Treatment, right? They're the ones who do all of the sort of substance use programming at the health department. Likewise, if we look at something like environmental health, very large category of work, and they have a Bureau of Food Safety and Community Sanitation. They're the bureau that does the programmatic work of doing restaurant inspections and other types of work like that. And that extends to all of these different lines. So each line here on this org chart actually represents hundreds of people's programmatic work. Our division, the Division of Emergency Preparedness and Response, is down here in the bottom right-hand corner. And we have 4 bureaus that I'm going to talk a little bit about in just a moment. So actually, I'm going to talk about it right. I reorganized the slides a little bit, so things are a little bit in a little bit different order from what I remember. So these are our 4 bureaus down here at the bottom. So our division, Office of Emergency Preparedness and Response, is structured into these 4 units, again, doing sort of the different programmatic areas. So from left to right, we have Agency Preparedness and Response. This bureau is responsible for figuring out all of the ways in which the health department itself is going to respond during emergencies. So we stand up a system called the Incident Command System that helps us organize our emergency responses. And they're the ones who define like who are all the people that slot into that and what are their roles and what does everybody do in an emergency. Our Bureau of Healthcare and Community Readiness do exactly that. They do readiness with stakeholders outside of the health department, in particular the healthcare sector. So they work with a lot of hospitals and nursing homes and other types of healthcare settings to make sure that they are prepared in the event of an emergency. They know what they have to do to both protect the populations that are currently in those settings, particularly in the cases of nursing homes, and also prepared to receive a larger potentially surge of patients in the case of hospitals, right? If we have a large fire or something and more patients are going to be coming to a specific hospital, they know what they need to do to surge their capacity to meet that extra need. And they also work with community-based organizations. So we know that community and faith and other organizations play a really important role in the way that communities respond to and recover from emergencies. And so we also work with those community-based organizations to make sure that they themselves are prepared to better serve their own communities in a crisis. The Bureau of Emergency Field Operations, they oversee what I call sort of our assets sort of out in the world. So that includes both physical and human assets. So things like we have warehouses where we stockpile PPE and medication and all sorts of other things that we might need in the event of an emergency. They oversee all of those warehousing efforts. They're the ones who oversee when we have to do sort of mass prophylaxis or mass treatment sites, like our big vaccine sites during COVID you might have seen. And they also oversee human resources assets out in the field. So, for example, we have a program called the Medical Reserve Corps, which is a volunteer organization. So for like retired or other medical professionals can sign up. And if we have an emergency where we need additional sort of clinical or healthcare capacity, they can volunteer to help us through the Medical Reserve Corps. And lastly, our Bureau of Grants Management and Administration play a really important role for us. Our work is very largely funded by federal and other grants. And so they are the ones who make sure that we're meeting our grant deliverables on time and making sure that all the work's getting paid for and that we're out looking for new funding opportunities. All of that kind of work is happening in the Bureau of Grants Management and Administration. There are two other units, the Racial Equity and Social Justice Unit, that do exactly that. That there are two staff that report directly to the Deputy Commissioner, dedicated to making sure that we apply those principles to the rest of our work. And Pandemic Response Institute, which is now a slightly larger unit. This is me and my staff. That we do some kind of like special projects management, again within the Deputy Commissioner's office, the Deputy Commissioner who oversees this whole office. So that's our division. Like I mentioned, sort of the city is a very high risk place, and every response is a local response. At the end of the day, we are the first line of defense, because we're here already, right? We live in the city. This is our city. This is your local public health department, and so we are the first line of defense when an emergency happens. We manage preparedness, the detection of emergencies, response and recovery, specifically around these types of public health emergencies. This is a discipline that's fairly young, so we learn a lot all the time, and it's growing, but it's critical in addressing the public health impacts of an emergency. So this field sort of was born out of 9/11, so it's really about 25 years old at this point. Before that, the fields of emergency management and public health were sort of considered very separate, but 9/11 sort of cast some light on the need to create a discipline that was a blend of both of those things because of the tremendous public health impacts of that attack and the events sort of coming after it. So there were some the anthrax letters and things like that you may remember if you were around back then. And public health preparedness are the glue inside and outside the health department when it comes to public health emergencies. So if there's an emergency that is primarily one that impacts the public's health, like an infectious disease outbreak, we are the ones who run that emergency for the whole city. We work with a couple of other agencies, but we oversee that work. We are the ones, and our office specifically are the ones who are making sure that everybody knows what their role is and everybody's doing the right thing when a crisis happens. Our core competencies during an emergency. So I talked to you a little bit about what our functions are in general, but during an emergency, the health department does a few really specific things. We conduct disease surveillance and determine risk levels, something you may have seen during COVID-19, or more recently, we had that mpox outbreak a few years ago, as well as a measles outbreak in one of our uh, asylum seeker shelters recently. We provide guidance to the healthcare community regarding disease identification and treatment, particularly when it's something that they haven't really seen before or is really rare. We work very closely with the healthcare sector. We distribute medications to the public, like I mentioned, COVID vaccines, but other vaccines we do, as well as antibiotic prophylactic treatment if there's some sort of exposure like that, or any other really kind of medication that needs to be distributed very quickly and at scale is something that we do. We support the healthcare system through technical guidance, situational awareness, and resources. So we help them do infection control, and we help provide them with additional, gloves and masks and gowns if there's a shortage. We do all kinds of work supporting the healthcare system in that regard. We provide emergency information to the public. We communicate out through multiple communications channels to make sure the public knows what they need to do and when they need to do it when it comes to preparing for or responding to emergencies or keeping themselves and their families safe. We provide safety information to the public and emergency workers regarding potential hazards in different environments. So if there's specific guidance going to the public, something that they need to know in order to make themselves safer when they're going about their jobs or going about out in the world, we provide that kind of information as well, and we coordinate mental health needs and services. So all of these are sort of core competencies during emergencies. We do lots of other things, but this is sort of a concrete list of a lot of our big emergency functions. And we've responded to lots of emergencies over the years, stretching back to, and again, this is only in the last 20 some odd years, but the health department's been responding to emergencies for hundreds of years. But in those last 20 some odd years, we're looking at West Nile virus back in the 90s. I mentioned 9/11 already. Moving up in time a little bit, we have things like Superstorm Sandy, which we are still recovering from some of the impacts of the Zika virus outbreaks in the sort of mid 2010s. There was a big measles outbreak in Brooklyn around 2019. That was my first emergency response. And more recently, of course, we have COVID-19 and mpox. We had that measles outbreak again that I just mentioned, and who knows what the next emergency will be. It seems that public health emergencies, are becoming more and more frequent with changing climate and geopolitical changes and all sorts of other causes. It's not a matter of if there will be another emergency, it's simply a matter of when. So you may have seen some of the things that we did during COVID-19 if you were in the city during that time, some of our public communication stuff. You may have gotten a vaccine from us, but what you might not have seen was all of the things that we did, and particularly at scale. We distributed over 100 million pieces of personal protective equipment, including ventilators for hospitals. We distributed 65,000 courses of COVID therapeutics back when there was a severe shortage of medicine when it was first released. We also made sure it was equitably delivered to the public, and we did so via home delivery so that it could be accessed by homebound patients. We established a task force for racial equity to identify the neighborhoods hardest hit during COVID and focus our programmatic resources there to try to reduce health disparities. We answered nearly 400,000 phone calls from healthcare providers and the public through our many call centers, trying to, again, provide information and provide guidance to as many people and healthcare providers as possible. And we distributed by now almost certainly far more than 18 million doses of COVID vaccine. But as of June 2022, we were just about 18 million doses of COVID 19 vaccine delivered, and many, many other functions. We managed isolation and quarantine, including large hotels where people could quarantine if they didn't have a place to safely do it. We did hyperlocal testing efforts, having vans go out in communities and do localized testing. We provided technical assistance for long-term care, many, many other things that we did during the COVID-19 pandemic. And we just have a couple photos here. So this is one of our warehouses so that you can sort of get an idea of just the huge amount of stuff that we have stockpiled for the in the event of an emergency. And here's a picture from one of our mass vaccination sites. Again, during COVID, this one was in a school. I think this is actually the one that I worked in. But we had sites just like this all over the city, again, pumping out millions of vaccinations over the course of a couple years. So that is a very, very quick, blast through the kinds of work that we do. There are, of course, lots of other things that we do as well, but I want to change gears a little bit and talk to you all about the opportunities that we have available for you now. So this is probably one of the most exciting and necessary times to get into this field of public health emergency preparedness and response. It's not really one that you might learn about while you're in public health school, but it is a critically important sort of subfield of public health and of emergency management. Public health has obviously been in the spotlight, in particular since COVID-19. There is a renewed energy for preparedness to make sure that something like that does not happen again, or if it does, that we can sort of mitigate its worst impacts. We, during the pandemic, made tremendous strides in developing a data-driven and more equitable emergency response, and we want to build on that work because COVID-19, like every other emergency that has ever happened, had disparate impacts on communities that have been disinvested in or disenfranchised over the course of centuries in the United States. And we want to, again, sort of mitigate those impacts. But there are also many challenges that we're facing now. Like I mentioned, emergencies are becoming more frequent and also more complex. The complexity, not just relating to the sort of size of the emergencies, right? I mean, obviously, COVID-19 was hopefully a once in a century event, but one of the largest public health emergencies we've ever seen, but also complexity in that some of these emergencies are going to start happening at the same time. And how do we manage that, right? How do we manage a hurricane response during a heat wave? How do we manage an infectious disease outbreak when there's a decline in air quality due to wildfire smoke, right? These things are going to be happening at the same time. And as a result, the responses to them are going to get more complex. And we need really smart, engaged, passionate people to come work for us and help us solve these really complicated problems. We've also been dealing with workforce shortages. There was, I think, understandably quite a lot of burnout after the pandemic. And so we are working on programs like the one I'm about to talk to you about to try to turn those around. We really need people to come work with us here at the health department, here in our office. And of course, we're dealing with the politicization of public health. I see that someone has already asked a question about that in the chat. But, we are dealing with tremendous amounts of misinformation and disinformation and, a lot of questions coming up around, how do we do public health sort of in this decade, in this century, in this sort of climate. And those are also issues that we need smart people to come help us come help us work on, but they're the challenges that we are facing. So our current opportunity, the main one I'm here to talk to you about today, is called the Pipeline to Preparedness Fellowship. Its purpose is to bring students from diverse backgrounds into this field. It is eligible only CUNY students are eligible for this opportunity, which I think is really exciting. Like Maya mentioned, it's a 10-month-long paid fellowship. You students, you guys are paired up with a mentor in our office to work on a specific project. But you will also have the opportunity to get exposure to lots of different work that's happening in our division. You can work on other projects while you're here. There's lots of really exciting opportunities available to you through the course of this fellowship. You will make all of this work needs to happen. You will make meaningful contributions and advance the work of our agency by being in this fellowship. Nothing that we are doing is just a make work project for an intern. All of these things are really important projects that we desperately need someone to help us work on, and that's why they have ended up as projects as part of this fellowship. And of course, this is going to open up, if you are interested, access to career opportunities at the New York City Health Department. Saba's about to talk to you in a minute, but any experience in government gives you a leg up in seeking employment in government going forward from there, and you will get exposure to other offices within the agency, not just ours. And maybe you'll find something that you're really interested in there, or maybe you'll find that you're all of a sudden very passionate for emergency preparedness and response, like many of our former fellows have found. There are lots of opportunities to get exposure and experience with the wide breadth of work that our agency and our office does. Before I throw it over to Saba, I just want to talk about a little bit about what this year's projects are. We have 4 projects this year for our fellows. They are, in order, strengthening public health preparedness and response through community engagement and collaborative learning. This is with our social justice and equity team that I mentioned a little bit earlier. They want to put on a couple of events that are highlighting community-based organizations' work, the work that they do during emergency preparedness and response. One of the events is specifically focused on the Latin or Hispanic communities. But this is going to be a really interesting and important role in highlighting this work, in educating our staff about the work of community-based organizations, the work of racial equity, and an opportunity for you to interact with all of those sort of like external and internal partners in making these events a reality. You will also assist that team with continuing to develop a lot of the tools that they're developing to help us target our work, or better target our work towards advancing racial equity and social justice. And so this is it's a really exciting opportunity, particularly for someone who's excited about that kind of work. Second, enhancing divisional continuity planning. Our department does a lot of things that can't stop when an emergency happens, right? A lot of work that we do, if there's a big enough emergency and we need a lot of staff, a lot of work gets put on hold while we deal with the emergency. But there are some things we can't stop doing. We can't stop issuing birth certificates. We can't stop running the poison control hotline. There are hundreds of services that we call essential services that can't stop during an emergency. And we need someone to help us do more planning around how those services will continue running during an emergency. So this is a really important and frankly, a really valuable skill. Continuity planning is something that happens not just at the health department, but at every private or nonprofit organization should be doing some form of continuity planning to make sure that they can continue to provide their essential functions during an emergency or some other type of crisis. And the person who serves in this particular fellowship role will have a really exciting opportunity to work not just with the people in our office, but with the continuity coordinators in each of the other divisions of the health department. So this person will get a lot of exposure to all of the different work that's happening at the health department. By the end of your fellowship, you'll probably know more about it than I do. And you will be developing templates and plans for these planning functions to sort of enhance those planning functions and to execute on them. The third project is healthcare resource allocation and developing a training and exercises equity checklist. So I've talked a lot about equity today already. During emergencies, it's incredibly important for us to focus on equity so that we can try to prevent many of the health disparities that happen, or negative outcomes that happen in communities of color and others. And so this team, which is the team that works with the healthcare sector to do preparedness, want to work on a series of tools and checklists and trainings to better develop protocols to prioritize marginalized communities during emergencies. Think about how we are allocating resources to those communities. So you might think of something like, are we making sure that we're putting vaccine sites in specific neighborhoods in the Bronx or Brooklyn or whatever it might be that are being disproportionately impacted by the particular emergency that's happening. But lots of really important work happening in that space, particularly in healthcare, to make sure that that type of care is accessible to everybody. And lastly, developing logistics plans and drills with our Bureau of Emergency Field Operations. So those ones who manage all of those assets out in the field, like I talked about. Logistics is obviously a really important component of that, how all of those supplies and equipment move around in the most sort of efficient and effective manner. And so we need a fellow to help us develop a series of standard operating procedures and logistics plans for how those resources move around the city during an emergency. Is incredibly important work. And you will get experience in developing drills and trainings for those logistics as well. So creating exercises and trainings, again, another really valuable skill and experience to have, and doing it for something so incredibly important, I think is a really exciting opportunity for one of our fellows. So those are our 4 projects. I'm happy to answer any other questions about those projects, at least to my ability. I'm not the mentor for any of those. But I want to now pass it over to Saba to talk a little bit about her experience as a fellow. We brought her on a few years ago as a fellow. She actually served for 2 years. We loved her so much that we kept her on for an extra year of the fellowship, and then we hired her at the end of all that. So Saba, please introduce yourself and take it away.
Yeah, thank you so much, Matt. And welcome everyone. I really do hope you're kind of taking notes on all of this. It's a lot of info, but all very exciting. So hello everyone, my name is Saba. I, as Matt alluded to, I was a fellow from 2022 to 2024. And I recently accepted a role of a senior program manager in the Bureau of Healthcare and Community Readiness here at OPER. Next slide, please. Alrighty, so photos or it didn't happen. This is me and my graduation at CUNY SPH. So you do know that I am a student. I have a bachelor's degree in public health and a master in public health. I specifically did health policy and management and was able to do my fellowship throughout those 2 years of my degree program. Other recent experiences that I did have within this last year was that I was a CUNY SPH student ambassador. So I do know a little bit about their admission cycles. If there are any questions with that, I can help out. In addition to that, I worked with exec admin in Health and Hospitals Elmhurst, and I was a care coordinator for a little bit at Sloan Kettering. Prior to accepting my fellowship role, I had experience in the COVID-19 vaccine hesitancy research. And I would go out to the different boroughs and hold focus groups in English and Spanish to get community thoughts on vaccine hesitancy. And in addition to that, I also served as a special projects manager at the Center for Puerto Rican Studies. So I had a little bit of community-oriented work and research work prior to my fellowship beginning. Next slide, please. So in my experience, the fellowship structure was work and learning coinciding together, both happening at the same exact time. My first day that I started the fellowship, I was fully integrated into the city work. I had city employees, directors speak to me as if I was a city employee, which I very much appreciated. Sometimes on the fellowship side, you could feel like there's a bit of a power dynamic, but my office, I guess I was just really lucky to work around people who were really encouraging, integrating, and they wanted me to have a seat at the table. So I hugely appreciate that, and I still feel that way. So I guess that's why I'm here. In addition to working, you have research opportunities, networking opportunities. You're really here to learn the field. And I think in my experience on the health policy and management side, I learned about the government from an external point of view. And I think really being able to work for the government locally, you're able to see the different processes that come into play and impact the day-to-day work that you have. So there are definitely work opportunities, but you do have a priority on your education. Your mentor will or should, definitely take in your academic calendar into mind. Mine definitely did. So when your midterms are around, your finals are around, we're definitely flexible. And that being said, the fellowship also works into fulfilling fieldwork requirements if you want that, and can inspire your public health 698 capstone course topic if that's also of interest to you. It was to me, so that worked out really wonderfully. Next slide, please. So my fellowship project, near and dear to my heart, I did a national policy review, so crisis standards of care. I specifically work in the Bureau of Healthcare and Community Readiness. So with that kind of context, we really care about how hospitals and healthcare settings are prepared for an emergency. So I went state by state and looked at all the different regulatory guidances that were developed before the pandemic, during the pandemic, and you know, some states still haven't developed them, so they're in a little bit of a odd situation. I have a figure on this right-hand side. I typically wanted to look for equity considerations as that was a big interest of mine. So seeing what kind of things were included or excluded. Some plans didn't include considerations for their disability, accessibility, and functional needs populations. And that was really interesting to me because that could put your general public at a disadvantage if it's not taken into consideration on the policy level. So it was really interesting, a lot of reading, but it did lead to some really cool outcomes. So I was able to develop a white paper, an equity manual, and I'm currently working on publishing a scoping review. So now that I'm back, I'm able to kind of continue some of that work, which is really exciting. Next slide, please. All right. And I do want to say that this fellowship has impacted my career path for sure. My network kind of quadrupled. I spoke to people within my bureau, outside of my bureau, within my office, outside of my office. And in my position, Matt alluded to the Healthcare and Community Readiness Bureau. We work a lot with external partners. So now I'm in my role as a senior program manager, I'm speaking to hospitals and other healthcare facilities and nursing homes and different kind of stakeholders to see what they're doing. Your network expands really quickly here is what I've learned. And graciously, of course, I'm really grateful for that. In my experience with the health department too, I learned that we really value professional development. Our team, I believe we request that everyone has at least one opportunity per year. However, on my onboarding, my mentor was really great. She told me about the free trainings. So if you are interested in public health emergency preparedness or emergency management, I would highly recommend looking up the Department of Homeland Security's ICS trainings, which is their incident command system. If you are interested in working for the health department or external in any emergency setting, they would likely ask that you have the basics of these trainings. Fully free, you could create an account and have a certificate within a couple days. It's really cool. In addition to that, the health department sponsors LinkedIn learning trainings. Within my first year, I was able to complete a full data analysis LinkedIn learning training and receive a certificate. I didn't have to pay for it at all. It was really great. And I was getting paid from the fellowship to do it. So again, like I said, you're really supported here. And these opportunities they're definitely going to be made aware for you as a fellow. I was also able to attend in-person emergency management trainings with the New York City Emergency Management Office. I believe they're in Brooklyn. They have certain trainings from time to time. Their website is public. If you are interested, you can take a look at that. And conferences as well. So this picture on the left-hand side is my team and I, or a few members of them, where I was able to join a conference within a month of my onboarding last year. And that's because we have really good connections with some of the external stakeholders we work with. And they informed us of it within a couple weeks, and we were able to just go ahead and head out. It was really well supported. I'm extremely grateful for that too. So as a CUNY SPH alum, as a student, I think we all, and just being alive in this kind of climate that we're in, I think we're all worried about having a job and keeping a job and retaining ourselves. So what really helps me are the agency communications that go out. We have job opportunities that are sent to us monthly. In our office, I believe our DC sends these updates weekly or biweekly. And we're also encouraged to take civil service exams, which can lead to you being a permanent city employee, which gives you other benefits like, well, you get benefits like retirement, 401k, et cetera, health insurance, all the great things. And as a former student, I do want to plug in the SPH resources. Career Skills Academy. I was in both I believe the beginner and the advanced track. So I did that for 2 years. Handshake is a great platform. You're only sponsored with CUNY for the time that you're there. So please use your resources. Weekly field notes go out to you, I believe, every Tuesday or Wednesday, and then Career Services newsletter goes out every week as well. You also have, I believe, the APHA subscription. So please do take advantage of all of the resources CUNY offers. Some of the experiences I mentioned earlier in my slides, the one with health and hospitals, exec admin, those were postings that I applied to on Handshake and I was able to get. So please, please, please do use your resources, use your colleagues, use your professors, your network. A lot of the time, who you know can really improve what you have. So please do not take that lightly. I believe that's all from me. Matt, if you'd like to proceed. Yes, great.
Yes, it is. Thank you, Saba, and specifically apply to our opportunities. So here are the basic details. We are currently recruiting for our next cycle of fellows who will start on July 1st. So the 10-month cycle runs from July 1st through the end of April. If you would like to apply, there's a posting on Handshake. I will also share the text of the posting with Maya after this to share around. You should send you a resume and a brief cover letter to Oprah Fellowships at health@nyc.gov or apply on Handshake. And you want to include in your cover letter what your top 2 project choices of the ones that I spelled out for you. We can't promise everyone, is going to get or be interviewed for their first choice. And so we want to make sure that we're at least interviewing people for something that they are interested in. The deadline for applications is April 15th. So you have a little bit of time, but the sooner you apply, the sooner it's sort of out of your brain and off into the world, and I can look at your resume and all that good stuff. So those are the details for the fellowship. As far as if there's anyone on the call right now so the fellowship, I should say, this is an important detail. You are only eligible for the fellowship if you are a current student when it starts. So if you are graduating in May or June or whenever the CUNY graduation date is, you're not eligible to be a fellow for this year. You can, however, during the fellowship graduate and sort of continue on, and that is okay. So people, if you're going to graduate in like December or whatever, there are people who sort of graduate on off cycles. That's totally fine. We've had people graduate during the fall or in the winter and stay on till the end of the fellowship. And it sort of gives them a nice little off-ramp opportunity to find a job while they're still sitting in our fellowship. But if you are someone who is graduating in the next couple of months, I just wanted to highlight that we do have some open positions. I can't spell them all out for you. There are too many for me to sort of detail for you in general. I'm going to share the slides out with Maya as well. She can share these around. These job IDs you can search for directly on the website I'm about to share with you on the next page. In particular, for graduating students, I would recommend looking at anything with the word coordinator in it. So if you're interested in things like grants or like grants management or administration, if you're like a policy or management student and you want to do that kind of work, contract and budget coordinator is a great place to look. Likewise, our field operations training coordinator in our Bureau of Emergency Field Operations, they are going to be doing a lot of the trainings around all of that sort of like field work and resources we have out in the world. All interesting things. All of these jobs are really great and really fascinating and are worth at least looking at, because if you're a student who has a little bit more experience, I'm not one to say that you're not eligible to get one of these slightly higher, manager or other titles. So definitely take a look if working for us is something that you're interested in. As far as applying to city jobs, I just wanted to share the 3 main places you might want to look to do it. cityjobs.nyc.gov is the city's main jobs website. We are required, every city agency is required by law to post their open postings on that website. So you might find our postings on LinkedIn or other places, but if you really want to know that you're not missing anything, that website is the place to look. We do also hire people through what we call fiscal agents or not-for-profit fiscal agents. The 2 that we use the most are Public Health Solutions and Fund for Public Health in New York City. So you can also look in those places to get jobs at the health department, even though they're not sort of official civil service jobs. They're pretty much just as good. If you've heard anything else that interests you today, obviously we're going to jump into questions right now. You can always feel free to reach out to me or to Saba. We love talking to students. I do it all the time, answering questions about the agency or about our office or, more opportunities. We're happy to do all of that. But let's turn it to you guys for the rest of this and ask some questions. Maya, I know you sent me some questions over email. I don't know if you want me to just run through those really quick first. I'm going to stop sharing my screen here. And Saba, I think you're able to stick around until the end of this, right? Or did you have to jump off early? Okay.
I could stay around.
Okay, great. So obviously I want you to weigh in on the answers to some of these questions too. So the first question that we received, what kinds of skills and experiences would make me a competitive candidate for the fellowship? The interesting thing about our division, I think, is that the people who work here come from all sorts of different kinds of backgrounds. Because we are a field that is sort of a merger between public health and emergency management, there are all kinds of relevant skill sets that apply to our work. And so I wouldn't identify necessarily any one particular skill or experience that makes you super competitive for this. I think you, as sort of a unique person and professional, are uniquely sort of qualified in your own way. I think our office is really great in that regard. I would certainly say, sort of your basic stuff like project management or the ability to sort of like look at data and understand what it means or present it, right? All of these kinds of things are helpful in pretty much any workplace. And I would certainly encourage you to highlight those things if you have them. And of course, really read the job posting and look at what the projects are about. And you can highlight what you think about yourself really fits those job descriptions. But otherwise, I don't know that I would necessarily identify any other specific skills. We're really looking for folks who are interested and enthusiastic. Those are our main two criteria. Everything else is like a bonus. Do you have anything else to add in that regard, Saba?
Yes, just to piggyback that last point, you want to show that you're passionate. It's okay if you don't know everything about the topic that's uploaded. I didn't know what crisis standards of care was like entirely, and it was a whole can of worms by the time I got there, but I was really interested from the COVID-19 work that I was doing and the other emergency work that I had in the hospitals that I worked in, and I just really like wanted to project that forward. So if you're interested in certain things, read the postings well, take the aspects of what you've learned and just run with it. You could also add some of your own background information. Personally, I added like where I grew up. So I'm born and raised in New York. I'm from the Bronx. Some of that kind of gave me a little bit of innate understanding of emergencies as well in like my local communities. So use your experiences to your advantage, and we're just going to be excited to read all of the different kinds of backgrounds y'all are coming from.
Thanks. The second question of 3 that I have here in front of me, what sorts of hard skills and soft skills can fellows expect to learn during the fellowship? Why don't you go first, Saba, and I'll follow up after that.
Yeah. So when it comes to soft skills, of course, you're going to develop better communication styles. You're going to kind of learn. So it's interesting. We're not directly corporate, but we are government. So there's going to be a lot of different active communications that you're going to learn. We love our acronyms here. So there's going to be a little bit of a curve, but that kind of dissipates as you continue on. Hard skills, I think, really depends on the topics that you're working with. When I was in my second year of being a fellow, one of our mentors had a project that was strictly on like not Power BI, but ArcGIS. I think it was Power BI. Though that fellow was then able to pick up learning those specific skills within those platforms. But overall, teamwork, transparency, different methods of communication. I think that's the generics of what you'll learn, Matt, if you have anything to up.
Yeah, that's great. I think I would just add, based on the sort of projects that I spelled out for you all, it's exactly as Saba says, right? Like you're going to get different skills depending on what it is you're working on, and all of the projects are different. But, you will get experience doing project management. Depending on the project, you could get experience in things like developing trainings or event planning. You might get experience in writing a standard operating procedure, which is something you have to do for many types of things. You might get some experience in like data analysis and presentation. All of you will get some presentation skills because you have to do a presentation at the end of the year of this fellowship. We have a little event where our fellows show the work that they've done over the last year. Lots of different skills that you can pick up depending on the project. And again, depending on what you yourself are interested in while you're here, you will have the opportunity to sort of to grow and to stretch into those other things, sort of give, if those things are happening in our office and we can connect you with the right people and you have a little extra capacity and you want to work on something else, we're always happy to make those kinds of connections happen. So if you've got something you're really interested in, you very likely will have the opportunity to at least do a little bit of it here. And then the last question, which I think I can very easily answer myself, are people with no public health experience encouraged to apply? Yes, absolutely. Students come from all sorts of different backgrounds. People in our field come from all sorts of different backgrounds. And so we are not excluding anyone based on any type of experience they may or may not have. The posting is being honest when it says that we are looking, anybody who is interested in public health and interested in emergency preparedness and response is encouraged to apply. We will figure out a way for your experience to sort of fit our experience here. So yes, absolutely. Don't hesitate to apply. We're happy to have you as long as you are a current student when the opportunity starts. Okay, I saw some questions come up in the chat as well. I want to make sure I'm getting to everyone. So how will the current political climate affect the budget and availability of services? What will be prioritized? I wish I had an answer to that question. We are learning pretty much at the same time as you are. We don't know what the future holds for us necessarily with this current federal administration, or with the way that we do our work. What I can say is that we, the local public health agency, and our state colleagues as well, are dedicated to doing this work. We are going to find a way to make this happen because it has to happen, right? Emergency preparedness can't wait until, in 4 years when we have a different president or whatever, right? Or when someone who's like a little bit more interested in this work comes along. This work needs to happen now so that we're prepared in the future. And so regardless of what this climate holds for us, we're gonna find a way to make it work because we just have to. And that includes our sort of dedication to equity. That does not change. Our disposition towards that does not change based on what anybody says. Okay, looking at other questions here. Do you guys have workshops on public engagement in order to gain the soft skills needed to work in this field, i.e. vaccine hesitancy in areas where outbreaks are common? We have a team that works on this kind of stuff. We have a communications team in our office. If that's the kind of work that you're interested in, I'm sure they would be interested in working with you. They don't have a project this year, but like I said, we can make sure that folks get exposure to all kinds of stuff that they're interested in. As far as workshops, like for you to learn, we do have, like Saba mentioned, lots of different training and professional development opportunities. I'm sure there's one on like health communication and risk communication. I don't know the specific one, but I'm quite confident that it's something that exists. These are things obviously that we think about all the time, particularly as it comes to vaccine hesitancy or trust in government or trust in the healthcare sector, right? These are all things that we are combating at the moment, and we need to continue to do that. Just to confirm 100%, if we graduate in May or June of this year, we're not eligible to participate. Yeah, that's right. If you're graduating in the next couple months, if you're graduating before July, then you are not eligible for the fellowship, but I would encourage you to look at the job postings that we have available. Any other questions? Folks can feel free, I guess, to jump off mic, or Maya, I don't know how you want to do it.
Yeah, we did have one more come in. Yep.
Yes, I see that. Have any fellows done analytic work using tools like ArcGIS or SAS during their fellowship? Yes, they absolutely have. We have had in the past fellowship opportunities dedicated specifically to those things. But again, if you can find a way to make it work into your project or are interested in expanding your abilities, I know that Mustafa, who is our director of data and analytics, always needs help and would be thrilled to have someone who knows how to use ArcGIS or like help out on a project. Saba, did you have something to add in that regard?
Yes, I did want to just say, just because you apply into one project, it doesn't limit you to that one. Even in my own experience, I was so passionate about equity that I decided to join the Oprah for Equity team, which does a bunch of trainings for project managers on how they could incorporate equity considerations into their projects. So yes, if you are interested in one specific posting, please do feel free to apply into that. And all of our colleagues are extremely kind, helpful, and in need of additional hands. So I'm sure if we were to connect you to those people, if chosen as a fellow, they'd be happy to help and guide you through some of those projects.
Yeah, I would definitely encourage, like, be interested in one of the projects that we've made available, right? Like that will be the thing that you're going to spend a bunch of your time on. I'm just highlighting that it won't be the only thing that you have to work on, right? There will be other opportunities to kind of expand your skill sets. But yes, you should at least be interested in the project you're applying for. That is something that we please ask. Other questions? Great question. Are these fellowships in person or can they be fully remote? They can be fully remote. We try to make our fellowship as flexible as possible. We know in particular with CUNY students, everybody's coming from a different situation. Everybody needs a different kind of flexibility. So our fellowship is flexible both in the number of hours that you'll do and the way that you can deliver them. So we let our fellows work up to 35 hours a week during school breaks. So that is over the summer or over the winter. You can work a full-time schedule. And then when you're in class, you can work up to 20 hours a week, so part-time. But those are not sort of necessary numbers to hit. It's a conversation with whoever your mentor will be as far as like how much work needs to get done and by when. We try to be flexible with those things. And likewise, we do make remote work available. I have found in the past, fellows have told me they really like coming and working with us in person. It gives them more value than just working sort of remotely and alone at home. They get the opportunity to interact with all the folks in the office and see what it's like to actually work in a place like this. They get to go to meetings in person. They get more exposure to the stuff that's happening around them. They find it is very valuable to work here in person, and we have a dedicated desk for our fellows. So there's always a place for you to come and work. But again, yes, we know everybody's situation is different. Lots of folks work mostly or fully remote during their fellowship time, and we make it work again depending on the mentor. Some folks, if there's like an important meeting or something and they really want you to be here, then stuff like that does happen from time to time, but you work it out with them, and they are all universally very flexible and understanding people. So I'm sure you could figure out a way to make it work.
Matt, is there a residency requirement?
There is no residency requirement that I know of. Again, it's sort of like we would love for you to be here. Unless I don't know does the CUNY Research Foundation have a residency requirement? Because we hire our students through CUNY RF.
Oh, I see. Okay.
Yeah.
Okay. Not sure about that.
Yeah, I can look into that and send that information out. So the way that this is structured, now that I've sort of revealed that, we structure our fellowship. We hire the students through RF CUNY, which is a very nice arrangement because you're already at CUNY, so there's a lot of information they sort of already have on you. And then we onboard you as a volunteer at the health department, where you sort of agree, you agree to all the health departmenty things, and we give you an email address and an ID and all that stuff. That's just really a financial arrangement with CUNY.
Okay.
Any last question? Yeah, we can go ahead.
Yeah, well, I just want to say thank you so much to our presenters. Thank you, Matt and Saba. This has been extremely helpful and informative, and I hope those that are in attendance, you're encouraged and motivated to apply for this opportunity. Like Matt mentioned, I think we are in a very critical time in public health. So this type of experience is definitely necessary, and this work is definitely necessary, just to make those meaningful, right, connections and contributions to public health outcomes. So no matter what's going on, public health is always needed and a priority. So just keeping that in mind. So with that, I am going to put a feedback survey in the chat for you all. If you can just fill that out on Handshake. And like we mentioned, there will be a post-event email with all this information and information on the fellowship. So thank you so much for joining us.
Thank you, Maya. Thank you, everyone.
Thank you all.